Okay. Okay, welcome to anyone who's just joining us. We're just going to wait a minute or two for others to start coming in. So thank you for joining this afternoon on this lovely Friday afternoon. I'm just going to give it about a minute and give people plenty of time to join us. It's great to see everyone joining. Okay, so I'll just introduce myself anyway. I'm going to be more in the background. So my name is Aoife Breslin and I'm the Marketing and Communication Manager for Sims IVF. So Sims is one of the largest fertility clinics in Ireland. We have 3 main locations. So we're based in Clonskeagh in South Dublin. We have a clinic in Swords in North Dublin. We have a clinic down in Cork as well. And then we also have a satellite clinic in Carlow, which can cater for you during your treatment, like for bloods and scans and things like that. So we're well spread out. I'm joined today by Mikey O'Brien, who's the clinical nursing director for Sims IVF, and he is going to just give us a quick kind of overview on options for same-sex couples and just a little bit on kind of treatments and testing that's available to you when you come in. So if you have any questions at all, please do pop them into the Q&A box and we'll answer them at the end, or if there's anything that I can answer in the meantime, I will. But yeah, just pop them all into the Q&A and I'll hand you over to Mikey.
Hi everyone, and thanks for joining today. I'm going to get this slideshow started. So as Aoife said, my name is Mikey O'Brien. I'm the Group Director of Nursing and Clinical Services for Sims IVF. And we have a clinic over in Swords, in Clonskeagh here in South Dublin, in the south of the country in Cork and in the Midlands as well. I'm obviously really passionate about fertility. I myself, I have a husband and we have 2 kids, thanks to the advancements in fertility care and treatments. I'm hoping today this presentation will give you some enlightenment on what we can offer here in Sims IVF. So I'm going to start the presentation by talking firstly about the journey, fertility journey. I'm going to touch on infertility, causes of infertility, investigations and treatment. And sometimes it can be a way, but especially with same-sex couples, you might know you have infertility or sub-infertility until you come to us for treatment using donor sperm. So the patient journey, for the most part, it will start with you filling in an online patient form. And that patient form goes to one of our patient coordinators, where they will then organize an initial consultation with one of our doctors. Now, we have 12 doctors across all our clinics in Clonskeagh. We have 5 doctors here, variation of male and female, and the same in our Swords clinic. So you can go online and check out the doctors, read their bios and see which one suits you best or which one you get a good feel for. You can put that on the request form and then you'll be given an appointment. Due to COVID at the moment, most of our consultations with the doctors are taking place over Zoom or by phone, whatever suits you and your partner. Once you have this consultation, the doctor will then order some investigations to be carried out. And the nursing team will normally hold your hand through this process. Once you have had your investigations and the results are back, they'll go back to your chosen doctor. Your doctor will review your results and then in collaboration with you and your partner will make a plan for your treatment. And once this plan is made, the nurses will get in touch with you again to plan your treatment. And there's always follow-up after your treatment, whether it's fertility preservation or fertility treatment to have a baby, and you'll always be followed closely by the doctor and the nurses here. So infertility, just to give a very brief overview of what infertility can be defined as. So in Ireland at the moment, what we would say it's infertility is no pregnancy or live birth after treatment or trying for a baby. If you're less than 35 after 6 months, if you're after 1 year, if you're less than 35, and if you're over 35 and you've been trying for 6 months, that would be classed as infertility. Research at the moment on heterosexual couples would say 1 in 5 couples at the moment have trouble conceiving a baby. And there's different types of infertility, which will be primary or secondary. And primary is if you've never been pregnant before, and secondary is if you have conceived a baby, whether it be with donor sperm, and you're having issues the second time around. That would be called secondary infertility. We also have reproductive choice, which will be solo females coming through to have treatment with donor sperm. So just to touch on the biological clock and what myths are out there, does age matter? Well, when it comes to fertility treatment, it absolutely does. You know, you're at your most fertile when you're between 20 and 25. And the number of eggs you have actually halves by the time you're 35. And then it halves again by the time you're 42. And then when you're over 46, sometimes you can have absolutely no eggs left at all. So it is important to check where your fertility is at, and I'll go through that now in a minute, and we can compare that to your age. So causes of infertility lie with your egg quality, you know, they can lie with sperm as well, and they can lie in the housing. And we say the housing, we talk about your uterine cavity, so your womb, your fallopian tubes, sometimes they can be blocked and you didn't even know, and implantation. So that would be when an egg is fertilized with donor sperm and an embryo is created, but it fails to implant to your womb and achieve a pregnancy. So there's investigations that we can carry out here in Sims IVF for both male and female. So for men that may be going down the surrogacy route in the likes of Canada or America or the Ukraine, we can offer a semen analysis, which is where we would check the number of sperm in a sample, the motility of the sperm, and morphology. But for females, we can absolutely offer blood tests, anatomical tests, and I'll go on to what else we can do as well. But when I talk about blood tests, I'm talking about things like your thyroid function, which we can call TSH. Sometimes if your thyroid is overactive or underactive, it can prevent you achieving a pregnancy. We also check your prolactin, which is a hormone produced by the pituitary gland. And if your prolactin happens to be high, and it can be high sometimes with stress, and we all experience stress, that can prevent you achieving a pregnancy. Your full blood count we'd look at to make sure you know you're not anemic, etc. Testosterone, if your testosterone is high or if it's low, it can prevent you achieving a pregnancy. We would look at your rubella, and rubella, it's just important that you're immune to rubella before you have fertility treatment. And then when we talk about day 3 and day 21 bloods, these are hormone bloods. We just want to make sure that your hormones are settled or your FSH is low at the start of your cycle to help you achieve a pregnancy. The big blood test you will hear about, though, is AMH. And AMH is your anti-Mullerian hormone. And this is a protein produced by the ovaries. And when we look at your AMH, it gives us an idea of how many eggs you have in your ovaries, but it doesn't give us an idea of quality. It basically, you know, if we look at your age and we look at the number, the AMH number that comes back to us. So if you look at this graph here, for example, if you're between 32 and 33 and your AMH came back at about 25, that would mean you have a normal ovarian reserve. If it came back down at 5, it could mean it's low. Now, depending on what you want to do with treatment, it might be that you want to freeze your eggs or you want to have fertility treatment to achieve a pregnancy. This is when the doctors would come into play and prescribe the treatment that's most appropriate for you. But we do define ovarian reserve as either normal, low, or high. And sometimes we can see a high AMH come back if you have a history of PCOS. But that doesn't mean you're not going to be able to achieve a pregnancy. It just gives us more insight into the treatment we can plan for you. When I talked about anatomical tests, I was talking about an SIS. So an SIS is a saline infusion sonography. This only takes about 10 minutes, and it's a detailed scan of your uterus, so your womb, and your ovaries, and your fallopian tubes. And it just wants to make sure that your fallopian tubes are clear. We can see how many follicles you have on your ovaries, which would give us an indication of egg count as well. And we also want to see that your womb doesn't have any fibroids or polyps, because when it does come to have an embryo transfer or fertility treatment, having a fibroid or a polyp can sometimes prevent you from achieving a pregnancy as well. Outside of this as well, we talk about lifestyle changes. So we do advise you to give up smoking if you do and you want to achieve a pregnancy. Alcohol and coffee consumption should be decreased. Exercise is always a good thing, but not extreme exercise. Stress, we do say if you can avoid stress, and try alternative therapies. But of course, fertility treatment can be stressful, and we do offer solutions to remedy this by seeing our counsellor or trying acupuncture, etc. And when it comes to your weight, the ideal weight for fertility treatment is definitely having a BMI less than 25. But if your BMI is up at 35 or 36, we're not going to refuse treatment for that. But what we would recommend is that you see our resident dietitian. So the treatments, well, just to start off, especially when we're talking about same-sex couples, we're going to use donor sperm. So who are our donors? Well, we use Cryos, which is a sperm bank in Denmark. And donors are ordinary and good physical health from a broad section of society whose ages range from like 18 to 50. Okay, they do receive a small remuneration for donation, but it is believed that they are genuine in their wish to help others. Okay, so what information would you have about the donor? Well, you'd know their color of their eyes, the color of their hair, their height, weight, type of build, their race, any peculiarities of their appearance, i.e. their complexion, their age, their education, what their occupation is, their blood type, karyotyping, so any genetic issues, their psychological profile, and then that they be free from any infectious diseases. When you do go down the donor sperm route, we will direct you to the Cryos website, and in collaboration with our nurses and our scientific director, they will give you instructions on how to select your donors. We would normally say you pick about 5 and then rank them 1 to 5, and we'll do our best to get the donor that you want, your number 1. There was new legislation that has been brought into play since May 2020 in that all donors must be identifiable. So this does not mean that you as a parent will receive the donor's identifying information though. However, any child born using an identifiable donor will at the age of consent, so 18, be entitled to the donor's identifying information. So that would be their last known address, their PPS number, etc. But regardless of this, the donor is not allowed to receive information about the identity of the recipient couple or the child, your child, and the donor has no paternal rights to a child born as a result of treatment to an anonymous couple using his sperm. So the treatments we do offer would be IUI with donor sperm, which is intrauterine insemination, IVF with donor sperm, social egg freezing if you're not ready to start your treatment to have a baby right now, and shared motherhood as well, which is reciprocal IVF. And I'll go into each one in detail now. So IUI with donor sperm has about a 23% success rate overall. And an IUI cycle is usually medicated, which would mean normally on day 1 of your period, you would give us a call into the clinic. And when your period has started, and on day 2, you would start medications, so follicle stimulating hormone medications, to stimulate your ovaries gently to produce 1 good sized follicle that month that will release an egg at a time that we'll be able to time using medications. And then we will insert the donor sperm into your uterus. It's nearly like a smear test, and you will do a pregnancy test 2 weeks later. With IVF, then we would say it's maximized success in minimum time. And the benefit of IVF as well, in that, because your eggs are collected, we're able to see what their quality is like. And then when we do fertilize the eggs and make embryos with the donor sperm, we can see what the embryo quality is like as well. So this is just a short guide of what IVF really is, in case you have no idea. So IVF is in vitro fertilization. So we'd start with at the start of your period, you would start stimulating medications. These are usually injections, and you start them on either day 2 or day 3 of your natural cycle. And this will help the ovaries produce more eggs. Usually around day 12 or day 13 of this, we will retrieve your eggs and we will fertilize those eggs with donor sperm. And then 5 days after we fertilize the eggs with the sperm, we would hope that we would have some embryos called blastocysts. And at this point is when we would transfer 1 embryo back to the uterus. And 12 days after this, you will be due to do a pregnancy test. The success rates at the moment with SIMS IVF sit at about, for fresh cycles, sit at between 49 and 50%. So they're quite strong, which is really good. So as I said, we also offer social egg freezing. If you're just not ready to start fertility treatment right now to achieve a baby, but you know you want it in a couple of years and you're worried about age having an impact on your success, you can absolutely come through, freeze your eggs, and then in 2 or 3 or 4 or 5 years' time, come back and use donor sperm to achieve a pregnancy. Then shared motherhood. So shared motherhood, what is it? It's when one partner is the birth mother and the other partner is the genetic mother. So the embryos are created again using donor sperm. So, you know, we would say for most couples, this really is a beautiful process and it allows both parents to have a unique linkage to the child. So we would say female A would have her eggs collected. These eggs are fertilized with donor sperm. Embryos are created, and then the embryo is transferred back to female B. So this process would start with a consultation for both partners with our doctor. You'd have counselling and implications counselling for both partners. You would sign consents. You would agree on which donor sperm you want, and then you are scheduled for your cycle. We would use the pill sometimes to coordinate cycles to ensure that, you know, both of you are at the same point in your own natural cycles. We would use medications to control this then. Once the embryo, as I said, is created, it's transferred to female B. So we always have to mention the cost of treatment. So of course there's a financial cost, but there's also a physical cost, an emotional cost, and a psychological cost. So, you know, starting with physical, you know, you're taking injections every day during fertility treatment. You know, and then if you do achieve a pregnancy, you know, there's always a risk of a miscarriage or an ectopic pregnancy or a chromosomal disorder. That risk is there all the time. There's always a risk of a twin pregnancy or a multiple pregnancy, which can be a high risk pregnancy. And then during the stimulating phase, sometimes your ovaries can respond very fast to medications, which we would call hyperstimulation, which can cause you some discomfort. And then the egg collection itself is day surgery. And we do focus a lot on the emotional and the psychological cost of fertility treatment too. You know, we do have patient support counsellors on call all the time for all of our treatments, because no matter what and no matter how optimistic or positive you feel coming through for treatment, you know, sometimes it doesn't always happen on the first go or the second go, you know, and it can be incredibly stressful, even though we're here telling you not to be stressed. So we would always say to avail of counselling support, or, you know, talk to your friends, talk to your partner, distract each other, make each other laugh, do nice things for each other, because, you know, fertility treatment is definitely tough. You would never call it easy. And then, you know, as I say to all of my patients, you know, it's important to be the best version of you, be determined, be flexible, because, you know, appointments, you know, it's going to bring more stress on yourself if you're trying to balance work and appointments for scans, etc., etc. Try and be emotionally resilient, lean on your friends, lean on us, lean on our counsellors, because really emotional survival is the key to success, you know, and it will help you get by. And that's it from me. So any questions there, Aoife?
No questions as yet, but sure, look, we'll just wait a few minutes, see if anyone has. I'm sure there's a few queries people might have. So we'll just give it a minute or two, see if people have. So yeah, you can tap them into the Q&A section there, and we'll do our best to answer them. Well, Mikey, maybe you've answered everything. Oh, here we go. Is there any facility to use a known donor, i.e. not an anonymous Danish donor? And that's a bit of a grey area, isn't it, Mikey?
Known donation, yeah. So I think when you say known donation, maybe you mean a friend,
Yeah.
and not at the moment. In Ireland, no, but in the UK, yes.
Yeah. Can we elaborate on the actual financial costs of each treatment? I think when it comes to costs and stuff like that, it's so dependent on the individual. We do our shared motherhood package. It does actually have a package price, so it kind of does tie everything up, and it works out a lot better if you're kind of going down that route. But in regards to like just generally financial, if you're going down the IU route or whichever route, it is very difficult to determine because it depends on the testing, it depends maybe what your partner needs as well. So it is hard to kind of just say top line what it's going to cost you. But we do have all our prices outlined on the website as well. So, but yeah, it's one of those things when you come in, you have a chat with their doctor, they'll tell you exactly maybe what you need, and then you have to sit down with their patient coordinators and they'll outline all the costs for you. I hope that kind of answers that. And is it possible to try for twins?
Is it possible to try for twins? A twin pregnancy would be seen as a high risk pregnancy. So that would mean sometimes transferring back two embryos. And the World Health Organization would not recommend transferring back two embryos unless, the client or the patient was signing a waiver for that. Saying that, there's always a risk when one embryo is transferred back that embryo can split and become twins. But the big thing here is that a twin pregnancy is a high risk pregnancy, so it wouldn't be something that we'd be able to advocate for.
Hi, this lady's already seeing a counsellor already. Does she need to see one of our counsellors before choosing donor sperm? Well, I think implication counselling is mandatory, isn't it?
Implications counselling is mandatory, yeah. So if the counsellor you're already seeing has trained in that or has been signed off in that, a letter would suffice.
Is there any blood tests that you can get done with your local doctor before attending the clinic? I think simple answer
absolutely.
Is yes.
Absolutely, yeah. So, if what you could do is if you had your consultation with your doctor here and the doctor gives you a list of blood tests that are required, you could have them with your GP. Yeah, 100%. I think the only one that GPs don't tend to do is the AMH. So that's the one that looks at egg quantity. But everything else like TSH, prolactin, all those bloods that I talked about, you can get them done with your GP.
Yeah, perfect. And what are the odds of a multiple birth? I don't know. I don't think I have those stats offhand.
Yeah, like the risk is always there with fertility treatment. And if you do opt for a double embryo transfer, so two embryos being transferred, if you're having IVF, the risk is definitely quite high. If you're having IUI treatment, sometimes when you get to the point of when we're going to insert the donor sperm, there could be two follicles there. So the risk of twins is there. It's not very high, but with fertility treatment, it's always there.
You're talking about percentage of success. Is the percentage lower if you're 35 to 40?
35 is the percentage lower. So, well, the best success rates would sit when you're in your 20s, but none of us are really ready to have kids when we're in our 20s now. So as you get older, the success rates will get lower and lower.
Is there currently a waiting list for initial consults or for treatments in general? Well, we have actually recently we actually have a large doctor team now. We have 11 doctors on our team, so our waiting list actually has reduced greatly. I think we're at around 3 weeks now for initial consult. Is that correct, Mikey?
Yeah, I think it's even less.
It's even less. Amazing. Yeah. So we actually do we should be able to get you seen to quite quickly because we've actually taken on a lot more new doctors. So we should be able to see quite quickly. Just wait and see if there's any more questions. I think we've answered a large amount of them there. So this one is, I've had my first consultation meeting yesterday and got an email about choosing sperm and about getting a smear test and blood test. Do I just contact you when that's all done?
And is that with us here in Sims IVF?
Not too sure. So maybe we could probably answer that offline. To be honest, that might be just a little bit more specific question to your actual treatment. So.
And
Yeah,
usually if you've had a consultation with the doctor, and that, you know, it is definitely best practice before fertility treatment to have your smears up to date. So absolutely, if you have your smear result, the doctor will ask you to send that in, or any blood tests you've already had. Yeah, absolutely, just send in the hard copies.
Okay, perfect. Okay. Right, I think that's like I said, if there is any kind of specific questions that you have, or if there's anything that you felt maybe wasn't covered today, you can send any questions on to communications@sims.ie, and you'll probably get an email from that email address anyway tomorrow. Just so yeah, if there is anything, yeah, the recording will be made available as well. So I'll hopefully pop that up either today or Monday. But yeah, it will be available on our YouTube channel, our website, and I'll share it on our socials as well. So yeah, you can look back on this. Again, if you have any further questions or anything like that, we'd be happy to answer them offline. So thank you so much for joining us today. Thank you so much, Mikey, for that brilliant presentation. And we hope you got something from this today. Thank you.
Thanks.